Hi, everyone. It's Emily, and I'm here with always a very special guest because we find the coolest people to come onto our podcast. But I'm here today with Dr. Shelly Bhowmik, who is the founder of Platform Wellness. And if you listen to my intro to this podcast, she's a double board certified physician specializing in preventative medicine and lifestyle medicine, aka, in my opinion, a double certified badass. And I'm really excited to talk with you today because your big thing that you help your patients and your clients with is burnout. And I'm dying to talk about burnout today because in the last, few years, maybe fueled more so from the pandemic, but you hear a lot about burnout. It's, from what I understand, and maybe a newer diagnosis. And we talk about it a lot, but I'm not sure that we really understand what it is. So really excited to have you here today. But yeah, thank you so much for coming.
Yeah, thank you so much for having me. And for the viewers and listeners out there, this has been a year in the making. So I'm so glad we are able to connect and talk about this really important topic.
It has literally been a year in the making. Like, Dr. Shelly is not joking. One of my first emails of us getting introduced was when I was pregnant. And our NAPS listeners know that Eloise is now over a year old. This always is something, family, life happens, travel happens, sick kids happen. And I was joking, everyone listening, with Dr. Shelly this morning. When the baby woke up, she was sick. And the first thing I thought, before I even was worried that she was sick or like call the pediatrician, the very, very first thing was, Dr. Shelly's coming on today, and I cannot delay this podcast because it has been a year in the making. She's totally fine, but I was like horrified at the thought that we might have to reschedule again.
Oh, no,
Oh my goodness.
we're making this happen.
So I want to hear more about you and your company because your company is so cool. And we'll talk about burnout. I think I definitely have so many questions around what that is and how do we know if we have it and all that. But how did you even fall into this space?
Yes. Happy to share my story, my experience of how I got here to be doing this work. As you mentioned, so I'm a physician by training, preventive medicine, lifestyle medicine, those are my medical specialties.
Mhm.
Um, but in the past couple of years, I started my business Platform Wellness to really help women in the workforce with burnout and mental and emotional health issues. It's such a big hot topic, especially post-pandemic. I think the pandemic really shed a light on how big of a problem this is. And so I work a lot with companies, with organizations to help their employees with stress and burnout. And really, the work for me, it's very personal because of my own experiences with stress and burnout and mental health issues. It wasn't too long ago that I was in a pretty bad place, and the scary part was that I didn't realize it. On the surface, things looked fine. I had a corner office on Fifth Ave. I was practicing as a physician in New York City. Everything looked great. But I wasn't well. And, depression is something that has woven its way in and out of my life ever since my mom passed from cancer when I was in college. So that's always kind of been underlying. The scary part, though, for me, beginning of 2020, so just before COVID hit, I didn't realize how bad things were until literally a Friday evening rush hour, standing at the edge of the subway platform, thinking about pushing myself over that edge.
Mhm.
And that was such a pivotal moment for me. I had never experienced anything like it before. It was really scary. To step away from that edge, literally and figuratively, was a journey in and of itself. And I'm one of those individuals who was so thankful to go into lockdown at the start of the pandemic because I literally needed that time and that space to heal.
Right.
But during that process, during that recovery, I came to realize that mindset is medicine. Your mindset is so powerful when it comes to elevating your health and well-being and quality of life. And it was just such a transformational lesson that I learned, that as a physician, I feel like it's my duty to pass that message on to other people, especially to other women and people of color, because at the end of the day, I don't want them to end up at that same edge or that same extreme.
Yeah.
And so that was my reason for starting Platform Wellness and for getting into this work.
It's incredible. I can't even imagine just like how overwhelming and scary that might have been for you to get to that place. And I think you say something that resonates with me in thinking of my own experiences and patients that we work with here, is that you also never really know how someone's doing. Like, you can check out really well on paper and you look like, you're functioning on the outside, and that you have I'm talking about thinking about women we work with, like you have the baby and you're back at work and you show up to your job and you're getting the groceries and you're running the household, and you can look like you really have it all together, and you could be absolutely crumbling on the inside. And so I'd love to obviously talk about how to avoid getting to that place, but I think another piece of this conversation is, how do you know if you're in the place when you're living in it too, right? Versus seeing those around you who are in it. At that time in your life, what were your sort of circumstances? Like, were you working? Were you still in school at the time? Like, what sort of, I know you had lost your mom, which is a really devastating loss. How did this like build, you feel like, or how do you know?
Yeah, no, that's the tricky part, because I kind of didn't know. And I feel silly saying that sometimes, especially as a doctor, because, I see patients, I treat people with anxiety, with depression, with other mental health issues. And so, for me to not even see it in myself was it literally an eye-opening experience. But it's one of the things that I actually talk about when I work with individuals. So I have a framework that I call REST, and REST stands for Revive, Strive, and Thrive. So it's a three-part framework, and it's, again, to help individuals overcome burnout, handle stress, restore energy. And there are 9 steps in that framework. 2 of the steps actually one is to seek support, and the other is to cultivate connections. And the reason why I have those 2 steps in there is because, when you're in it, when you are mired in the stress and the burnout and all that it brings, it can be hard for you to see what's happening. And sometimes you need to lean on others for support during those times of stress to help you realize, okay, this is not me. This is not normal. It is not normal to be functioning this way. And
Right.
so being, again, in those times of stress and chronic stress, being able to lean on others is really important. You asked how might individuals be able to tell what they're dealing with, or if they're in burnout themselves.
Well, like, I'm not to be stupid or dumb question here, but like, what is burnout? Like, what does it really mean?
Yeah, it's a really, really great question. So burnout is an occupational syndrome. It's something that was defined by the WHO in 2019. And so it refers to chronic workplace stress that's not well managed. And in particular, there are 3 characteristics to it. So the first characteristic is feelings of energy depletion or exhaustion. The second characteristic is feelings of cynicism related to your work, or being depersonalized from the work that you do. And the third is decreased efficacy, so not performing at your usual level. And so those 3 characteristics are what describe burnout. And what I tell individuals, and this is the first step of the framework, it's to detect distress. You can't solve a problem if you don't even know you're dealing with the problem in the first place. And with burnout in particular, I find that one of the most common signs and symptoms, it's the physical signs and symptoms, and you know what I'm talking about here. It's the hair loss, it's the stomach aches, it's the migraines, it's the eczema flare-ups, it's so on and so forth. We are so good as human beings, especially as women, as moms, to kind of brush aside all of all of those signs and symptoms we might be experiencing, and we
Right.
probably have been experiencing them for so long that we it's really easy to ignore. But those are like alarm bells that our body is signaling to us that, hey, something's wrong here, something's up, we're not well, we're not functioning at our best. And so being able to notice those signs and symptoms, I think, is one of the very first steps to really get a sense of what, if you're dealing with chronic stress or burnout.
Yeah. Well, I love how you called them alarms. I I am a big fan of the Mel Robbins podcast. I listen to it a lot, but she had brought on this neuroscientist who talked about anxiety, and he described it as an alarm, but how it can manifest, right? Whether it's that chest pain or the stomach aches. And so I love this concept of the alarm, because when I first heard it, I started to think about triggers that go off in my own body, and it's an alarm letting me know, like, you're anxious or you're stressed. And we're really, really good at, like, I don't even know if we're pushing the alarm away, but like, I can fully ignore my alarm and carry on with many alarms ringing at once. like like I don't have time for the stomach ache, I don't have time for the migraine or the anxiety, I've got the 3 kids, we got to get to school, somebody's sick. And this is what we do. And is it like we're suppressing them, or we're ignoring them? We learn to function with these alarms going off. It's incredible.
Yeah, yeah. And I think what happens is it's chronic, right? Over time, it just builds and builds. And then it gets to a point where we finally realize that we can't keep, living the way that we're living unless we make a change. And in a lot of cases, it's probably an extreme example. I mean, I think one of the more extreme examples is, for folks who have heart attacks, for example. A lot of the times, those, the causes for a heart attack, they're chronic, they're long standing. But in those moments of stress, for example, that's when you see a lot of individuals experience that health condition. And so, yeah, the stress that we're under as a society, it's really not something that we can ignore anymore. We really have to pay attention to the way that we live day to day, because it is really impacting our health and our well-being.
Right. So I have like a little bit of a story for you without going off on too much of a tangent, which people know me for my tangents, but
I love tangents.
we're obviously women, and I know not just women listen to our podcast, parents of all sorts do, but I think of my husband, who actually was diagnosed with burnout. But flash forward back, you said the diagnosis was 2019.
That the WHO, yeah.
Came out. Yep. My second daughter was born in 2017. And about a year after she was born, my husband was really struggling. He was working at a job that was not a great culture or environment, a bit toxic in my opinion, many, many hours. Plus we have 2 little kids at home. And it sort of just snowballed into like working really late, getting home and working, waking up in the night thinking about work, working on the weekends, like fully, when you talk about this like energy depletion or exhaustion in the workplace, like that was him fully. And he went in and told his primary care that he was struggling, and right away was diagnosed with depression. He wasn't depressed though. He had classic burnout. So to flash forward a lot of appointments and a really challenging summer where he was treated inappropriately and mismanaged for like depression. And then they labeled him maybe as anxiety. And he ended up finding his way to this incredible woman in Boston who's a psychiatrist, who really like listened to his life and his story and his history and was like, whoa, you're not depressed. You don't have anxiety. You have burnout. And really, to make a very long story short, he didn't need medication. He didn't need, he had therapy, which was great. He's really open about this too when he talks to people. So he won't mind that I'm sharing this, I promise. But he's very open with other dads and parents, which I think is cool. But what he needed to leave his job. And he didn't want to, because he had been there for so long, but he did. And he took time for himself, and holy shit, what a guy this guy is now. Like, he learned how to meditate. He prioritizes working out. He'll stop his workday to walk our dog in the middle of the day. He got a new job at a wonderful company that values its employees and parents and the workplace and has wonderful benefits and perks. Like he had to make a complete shift though in his life to do this. And that's not easy. But it, I know we are thinking a lot about women in this role, but I think of my husband and like how that happened too. And it was classic burnout.
Yeah,
I know I had seen it.
Yeah, I'm so glad you shared this story because I think this is a story that a lot of people can relate to. And, you bring up so many good points in it. The one in particular, the lifestyle changes that need to take place. That's really the key in terms of not only treating but preventing burnout in the first place. And I think people sometimes it can feel really overwhelming to make lifestyle changes. And so what I try to coach people on is to, make big change, but do it little by little. Make it bite-sized goals that you can achieve. I can't take credit for this, but I heard someone say once, set the bar so low that you trip over it.
Oh,
And it has been
that.
yeah, right. It has been so helpful for me because, especially as, high performing, high achieving individuals, we are so good at setting that bar crazy high and, pushing ourselves to excel with every single project and initiative and what have you. But no, I mean that's what creates that environment to burn out. And so setting that bar so low that you trip over it, it gives you those small wins. It starts to give you actually that momentum that you need to then energize you to keep going. And so that's one of the tips that I coach people on, because again, yeah, this burnout in particular, it affects people who are these high performing, high achieving individuals.
Right. Now I'm thinking, people listening might be thinking, I hear you, Emily. I might be feeling a little burned out or stressed, but you just said your husband left his job. Like, I can't leave my job. That's
Yeah.
it, right? So, like, what I would imagine a lot of people are listening to this and thinking, I feel this, and that feels overwhelming, that suggestion. Is there like a classic or one tip that you might have for somebody that is a parent and they're working and they're feeling this pull a little bit, like, and like you said, it's a habit, right? We brush our teeth every day, we're used to doing that. But if I said just meditate every day, like that's overwhelming to just do that. So is there like a go-to, like one small tip that you might have for that like person who is feeling this pull right now?
Yeah, so again, it's one of the steps of the rest framework, and it's to restore routine. And this is something that I definitely employ in my own lifestyle. When I say to restore routine, I am meaning getting back to the very, very basics of self-care and sustenance. So for example, in the American College of Lifestyle Medicine, there are 6 pillars to healthy living. And 3 of those pillars are nutrition, physical activity, and sleep. And I think those are the 3 that are most important to focus on when you are trying to recover from stress and burnout. And I want to be really clear here for the viewers and the listeners, I'm not saying that this is the best time to go, start intermittent fasting or sign up for a half marathon. It's not, that's not what I'm trying to get at. Again, I'm saying to get back to the very basics, eat foods that really nourish you, that make you feel good and healthy and whole. Move your body. You don't need to do some crazy exercise routine, but just make sure that you are getting physical activity and the sleep too. That's important. And I know that's really hard, especially for parents, for new parents. But any way that you can to be able to just get some restorative rest, that's going to be really key. That's going to give you the physical energy that you need to then kind of tackle some of the more difficult psychological or social issues that might need to be changed. So yeah, restoring routine, getting back to those basics of nutrition, physical activity, and sleep are really, really important.
I mean, you had me at sleep. I can get behind that anyway. I love sleeping.
Yes, it is so good. It is so
It is
good.
funny though. I think everybody sort of is drawn to something different. For me, if I'm feeling stressed or overwhelmed or like not my best self one day, what does make me feel better would be as if I took time to like actually take a nap and have some sleep and then I feel better. Versus I think if my husband were here and weighing in, he would say like moving his body, like actually going for a run or riding the Peloton. Now, great if we can put all of those things in combination, but we'll call out to each other like our percent or how we're feeling in a morning. Like, ooh, I'm a low percent right now. I need to go lay down. I said on Sunday, I said, can I take 20? I got to go take a 20. Or he'll say, I got to hop on the Peloton. So, but anyway, you had me at sleep. I can get behind that.
Yeah, no, and I think that's so great that and part of this is really understanding what works for you. There's
Right.
not a one size fits all solution here. You really have to, really have to dig deep and figure out, okay, what is going to make me feel better, make me feel
Right.
healthy and happy and whole. And so, for one person it's sleep, for one person it's physical activity, for another person it's, eating healthy foods. So yeah, I definitely advocate for that.
Yeah. And then I'm thinking about in terms of like mental health, anxiety, depression, and I referenced that this could be misdiagnosed. I would imagine some people are experiencing a combination of these things. If you have prior history of mental health, like for example, everybody at NAPS knows I have anxiety. I'm very open about it. I talk about it all the time. Pre having babies and during my pregnancies. Would I potentially be at higher risk for this because I am diagnosed and known to have anxiety? Like, are you at a higher risk of it for mental health purposes? Or I don't know. I would imagine that they're all like could be get connected in a way too.
No, exactly. That last point is really important. It is all connected. It's interwoven. At the end of the day, if you are suffering from any sort of mental health condition, you may not feel like you have the right resources and tools to deal well with all of life's daily stressors. And so because of that, that could, create a condition where you do end up getting stressed and burned out more so than the person next to you. So yeah, it's hard to tease apart. There's not necessarily, clear-cut boundaries with a lot of these conditions. And like I was saying before too, when with the physical manifestations of stress and burnout, for some people it's migraines. They know that whenever they get stressed, that they get these headaches, really bad headaches. For other people, it might be GI issues. They might have their IBS flare up, or for other folks, it's their skin. The eczema flare ups. All of these, they play out in different ways for different people. And so this is again another really important point to know your body. Know how you respond in different situations, because that is again going to be your alarm to find out what, to dig deeper and figure out what's going on.
Yeah. So this like rest piece, and then I believe you mentioned, was it strive and then thrive?
Yes.
What's in those buckets?
Revive, strive, and thrive. Yes.
Strive, and thrive. Like what then falls into those next layers? Because those sound nice.
Yeah.
I
So
want to thrive.
exactly. Well, one of the things that I really focus on is that mindset piece, like I had mentioned. At the end of the day, we none of us have control over these external stressors that happen to us. Things are going to keep getting thrown our way, thrown in our face. The only thing that we really have control over is how we respond to those stressors. Instead of reacting to them, figuring out thoughtful responses to them, how we show up. And that's something that takes a lot of reflection. It takes a lot of reframing too. When something happens, we might automatically think the worst, but then to be able to reframe it and to realize, okay, wait, no, maybe it's not so bad. Maybe I don't have to, go full force here. That's a really important piece of it. So the mindset piece is really important. And then again, in terms of a healthy lifestyle or healthy habits, being able to incorporate these changes so that they are long-term lifestyle goals. That's really the place that you're trying to get at, because at the end of the day, you want to have a great quality of life, and you can only do that if your lifestyle, if your long-term habits reflect that.
Right.
So those are some of the things that we touch on.
Yeah, and it can feel overwhelming to have that long-term thought process. So I love how you're like, just start really small. Not only
Yes.
set the bar really low, but then like start really small with something that you can do.
Yeah, yeah, definitely. And there are different ways to look at this. I mean, for some people, maybe it's having a capsule wardrobe that is just going to totally change their lives and take out a lot of stress. Not having to think about, okay, what am I going to wear every single morning. For other people, it might be meal planning. Maybe getting a list together at the start of the week and doing the grocery shopping, getting the meals prepped ahead of time. Like maybe that's where a lot of stress can be alleviated. It's going to be different for different people. And so again, knowing yourself is key. I think for everybody though, across the board, technology use is something that I really have people focus on because it is our devices are so addictive and they really can draw us back into some gnarly headspaces. So being able to really regulate how we use technology, when we use technology, that's something I have people look at for sure.
Yeah, that's a really good point. I think that's probably one of a common frustration for our parents can fall around like technology when you bring a baby home. Um, being on it too much or looking at it too much or not being able to put it down, when you're living in that parenting space,
Yeah.
especially dinner, bath, and bedtime.
Yeah, and it's not you. I mean, these devices are designed to do that. They're designed to make it so that you feel glued to it, that you can't put it down. So it's not, this isn't anything about willpower or, they're designed to do that. I'm not surprised.
So, and now here's another thought that I had too, just for people listening. What if people listening know someone in their life, like a friend or a family member, and they're thinking, oh wow, they're having a really hard time. And I've seen that or I recognize it more now that I'm listening to this. How do you have any recommendation for how they could approach that person or help that person at a basic level?
Yeah, yeah, I think, and I recommend this both in, professional life, personal life. The most important question that you can ask any individual is, how are you?
Mm.
Which is so freaking simple, but I have to tell you, as a physician, how are you? It's the first question that I'll ask a patient. And it's also the most important question that I'm going to ask a patient, because what I learned from that question is so much more valuable than any sort of, paper questionnaire that I might give them to fill out.
Mhm.
How are you? Well, and I should say, asking the question, how are you? And then shutting up, giving your friend the opportunity to respond, the space to respond.
Right.
That's where a really meaningful exchange can happen. Because I mean, we say it all the time. We'll say, how are you, when we jump on Zooms or when we pick up the phone, and it's almost like a throwaway. It's part of our greeting, and then we just move right into whatever we're doing. But to really ask
Wasteful.
them,
It is
yeah, yeah, it's
away.
wasteful. Yeah, but to really ask somebody, hey, how are you? And
Right.
then hear what they have to say, even if they respond initially with a one-word answer, you know, keep asking how they are doing.
So
And
I
and
was
so just
already thinking, as a clinician, what do you say next when people go, fine, fine?
yeah, yeah. Usually something, it depends on the person, but usually I'll say
Right.
something along the lines of, oh, okay, tell me more. Tell me more.
Tell
What's
me,
going
tell
on?
me
And
more.
I really, yeah, yeah. And I really do make a point to just stop talking, because at some point the person is going to, start to then feel more comfortable saying, oh, okay, they actually really want to know how I'm doing. Okay, well, let me tell them what just happened and the
You're
stress in my
waiting.
life. And
Right.
yeah, yeah. So yeah, it's really about giving people, giving them that safe space to be able to express how they really are feeling. You want to
I
create that container.
I
Yeah.
love that you said be quiet though too. Like if you have sometimes we get uncomfortable with silence and so we start filling it with words or we just move on to the next thing. But I love the concept of tell me more and then like actually just being quiet.
Yeah, yeah. And you don't have to badger the person. If they're really not,
Tell me
like,
more right now.
no, you're stressed out, tell me. No, no, it's yeah, you kind of have to read the room a little bit.
Totally.
if you feel comfortable in some cases being able to share how you're doing, that's also one way to kind of break the ice a little, so that potentially the other person feels more comfortable sharing, sharing some of their own personal experiences. So yeah, it depends on the person, on the situation, but how are you is such a powerful question that we throw away, and we
Right.
really need to leverage it.
So I talk to moms every day, all day long. And do you know what they say to me when I say, "How are you?"
What do they say?
They say, "The baby's okay. I mean, she was up a lot last night, or
Mhm.
breastfeeding's going well." And I'm like, it's always when I commonly ask moms how they're doing, especially postpartum, "How are you?" The first thing they'll say is how their baby is. And I'll let them
Yes.
finish and I'll say, "Okay, and how are you?"
That is, yes, amazing.
I
Yes, it
know,
is
right?
so yes, yes to all of that. I love that.
All about the baby though, and we're wired to just like answer about the baby, right? Or answer about our kids right away. I did it to you this morning. You asked how I was, and I told you that my baby was sick.
Right, right,
It's
right.
me.
Yes. Yes. No, it is. It's our culture. We're programmed to respond in this way. So a lot of this is kind of untangling all those wires that are
Right.
crisscrossed in our brains,
Um,
and creating new circuits in there, because it takes a lot of deprogramming to make some of these changes.
Yeah. Do you find that you lean into more so like of a woman population? Like, do mostly women seek you out, or are you drawn to working with women in this space?
Yeah, because of my experience, in particular, being able to talk to women, to women of color, I really enjoy working with those groups, because the stressors that we are under are can be so profound sometimes, and not everyone realizes just how weighty they can be. So to really help those individuals, those are yeah, that's where my heart is.
Oh, awesome. I feel like I read somewhere. Did you win an award, or you were recognized for
I
work
wish I was. I
with?
wish I was. Maybe you read something that I don't, but I
I okay, like something about working with women or women of color, some kind of acknowledgement. I'll come back to it.
okay. Okay. I mean, that would be amazing, but not that I can think of off the top of my
I want
head.
to deep dive into your podcast and your lives. I love listening to your content. Okay, so here's a question for you. Really, I think you're so awesome, Dr. Shelley. You're so fun to talk to. I love what you're doing. I think it's amazing. How do people find you? How do our listeners come and find you now and learn more? And what are you doing through your programming to help people?
Yeah, yeah, definitely. So my website is going to be the best way to reach me or to get in touch, and it's shellybhowmik.com. We can include it in the
We'll put it
notes.
in the show notes. Yeah.
Yeah, yeah. In particular, or I guess there are a couple of ways to work with me if folks are interested. One is, if you are in the New York, New Jersey area, I can, see you as a patient. So that's one way. If you're interested in learning more about the REST framework and in coaching, for example, that would be available to anyone anywhere. And there's a free masterclass that I have on the REST framework, and you'll see that on the website. So definitely sign up for that.
Oh, we'll
Um,
definitely link the free masterclass in the show notes. Like any free resource is wonderful for people to have.
yeah, yeah, definitely, definitely. And yeah, I mean, for those who are, in the corporate space and want to have some of this type of programming available to them through their employers, happy to reach out and talk to folks and see what we can do. Because at the end of the day, it's about helping populations become healthy and well. So yeah.
So, oh, thank you so much for being here. I really appreciate it. Could talk to you all day, but I have to be mindful of your time. I'm sure you have patience. And so thank you so much. And everyone listening, we'll link great resources in the show notes, and find Dr. Shelley, learn more about burnout, reach out if you have questions. And thanks so much, everyone, for listening. I'll be back next week. And thanks again, Dr. Shelley, for being here.
Thank you for having me. Thanks.
Bye.
Bye.